Yes, we're spending some time here at Summa Health. We're talking about gynecological cancers with an OBGYN and department chair, Dr. Edward Ferris. There are a number of different types.
That's true. The most common types, the ones that most people are aware of, are cervical cancer, uterine cancer, and ovarian cancer. There are some less common types that I think a lot of women are unaware of, and that is fallopian tube cancer, vaginal and vulvar cancers. And then, of course, I think we should throw breast cancer in there as well.
It's very important that prevention, of course, is key. Number of screenings that Summa Health does offer. Let's talk about those.
Yeah. So the most important thing is just to have a routine exam, annual exam, including a physical exam and a pelvic exam and a pap smear, as well as a breast exam. Obviously, we can screen for breast cancer with mammograms. The other cancers are a little bit more challenging to screen for, and they're really based on some symptoms that might have changed for the patient that might lead to additional imaging or other tests such as a biopsy.
What are things that a woman should look out for? Warning signs, if you will?
Yeah. So I think any sort of change in how she feels with regards to menstrual bleeding or pelvic symptoms like pelvic pressure, pelvic discomfort, pelvic fullness, those can be certainly signs. Women who start bleeding after menopause, that's a big warning sign that they should definitely seek advice about.
We talk about prevention. We talk about being proactive. What can a woman do?
Yeah. So again, I think it goes back to just annual examinations, which will dictate what the next steps will be. Pap smears are done on a more periodic basis, but they need to keep up on those. Mammograms typically are done yearly. And then, there are other opportunities to screen based on family history. So it's important for patients to understand their family history so they can talk about screening for hereditary cancers as well.
I think it's a common misconception that a lot of women feel that they go through menopause, they're done seeing the doctor. It's just not the case, is it?
No, that's definitely not true. It's super important. Cancers become more common as you age for the most part. And so women after menopause definitely should still be seeking out care.
Doctor, let's talk about Summa Health and the commitment they have towards gynecological cancers.
Yeah, we're lucky at Summa Health because we have an excellent gynecologic oncology division. Our physicians and surgeons include Dr. Stephen Andrews, Dr. Robin Lasky, and Dr. Clarissa Polanday. They offer not only minimally invasive surgery, but all adjunctive type therapies for cancer, including chemotherapy, radiation therapy, and immunologic therapy, all of which we can do on this campus in this community so patients don't need to travel for their care elsewhere.
Well, we thank you for your time and your commitment. And for more information, you simply have to go to their website. It's so simple, summahealth.org/women.
This segment of Good Company was sponsored by Summa Health.